Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today I'm pleased to be joined by Anna Schlosser. Anna is a registered provisional psychologist at the Psynergy Centre in Medicine Hat. Anna works in trauma therapy through EMDR, ketamine-assisted psychotherapy, and somatic experiencing. She specializes in working with military, first responders, and more. Please welcome to the podcast, Anna. Thank you for being here.
Hi, thank you for having me.
All right, so I always just start with a really brief intro because I'd love to give you the opportunity to speak more about yourself. So please tell us about your background.
Sure. Yeah. I am a registered provisional psychologist and living in Medicine Hat at this time. I'm originally from the US, and so all of my education and sort of initial background training, I've been in the field for about 23 years doing mental health. So I've been in Canada close to 16 years. So I came here on a North American Fair Trade Agreement to work in the area of forensic psychology. I specialized in working with youth who were involved with the legal system, and then in particular sexual offenders. And so when I first came to Canada, I was working with that population. And then just since my time here, I've kind of evolved into other areas of practice. And the last few years have landed on more of the ketamine and psychedelic realm of things, as it's obviously becoming an emerging field. But I've been working with the medicine in terms of working with patients, preparing and integrating their experiences for about 6 or 7 years now.
That's amazing. In reading about you online, you have a very interesting background. There is going to be a link to your website so that people can learn more, because there is some very interesting credentials that you have. I definitely want to focus our conversation around your work with psychedelic therapy with trauma, because we get tons of questions about that. And obviously it's very topical right now, as a lot more changes are being made in different countries in terms of therapeutic benefits. So I have a very silly first question to ask you, which is this type of therapy legal?
Yes. Yeah. So that's a good question, because there are some distinctions and some nuances to the legalities. So at this time in Alberta, Alberta has made steps to regulating psychedelic assisted therapies, and in that process has regulated ketamine for treatments. And what that means, though, is that only a psychiatrist who has training on the use of ketamine for off-label, which is for the mental health purposes, the use that they offer. And so in order to be prescribed ketamine for mental health purposes, you need to have a prescription from a psychiatrist that has training that has been accepted and endorsed by the government of Alberta. So finding that can be a challenge. So there's not enough psychiatrists in general in Alberta, and there's definitely not enough psychiatrists that are trained in this area. So that poses some challenges in terms of accessibility. And then there are other psychedelics, though, that are such as psilocybin and MDMA that are accessible legally through the special access program. And there are some other opportunities through Section 56 exemptions, which are patient-driven exemptions, whereas special access programming is done through medical professionals' applications.
That's great. You answered one of the questions I was going to ask. What are the benefits of ketamine-assisted therapy for trauma?
There's quite a few. One of the things so you're asking specifically about trauma, but ketamine is actually very useful for other conditions as well. Maybe we'll talk about this, but I'll briefly touch on it. So anxiety, depression, OCD, for example, And when I say depression, more of the treatment-resistant depressions, maybe people have tried a lot of different medications and interventions, ECT, TMS, things like that. So the aspects of the benefits to some certain conditions that people really struggle with and that often have used medications for a really long time tend to respond quite well to ketamine.
Okay, great. And that kind of leads into my next question then. Who is a good candidate for ketamine therapy? And then on the flip side, who would not be a good candidate for that?
So, like I said, the patients who are treatment-resistant depression, but some of the health conditions that can come with ketamine. So there's like transient blood pressure, heart rate kinds of effects. So people who have untreated blood pressure conditions, high blood pressure, high heart rates, things like that, we have to really monitor coming into the sessions, and sometimes even screen them out initially or wait until their symptoms are more managed medically. People who have cirrhosis of the liver, who have bladder conditions, women who are pregnant or nursing, we don't approve to come into the program. There's also evidence that people who have active substance use sometimes are not good candidates for reasons of drug interaction, but also sometimes dependency interaction. So a lot of times when we're doing our screening process, we're not necessarily excluding people who have a history of substance use, but sometimes if they have a period of sobriety, it can kind of re-trigger the urge to use again. So we have to be really careful about the screening process for that. But I wanted to go back a little bit to one of your previous questions about the benefits. And so neuroplasticity is one of the main factors that helps people benefit from this treatment. Meaning it sort of acts like a reboot to your computer or a jump start to your car battery. It sort of gives you this relief on the onset that people respond to very quickly within the same day even. And so there are other benefits such as decreased nightmares, sleep disruption, flashbacks, improved emotion regulation, decreased symptomology related to avoidance behaviors. People with PTSD often want to not go in certain situations, crowded environments, things like that.
Okay, I'm glad you brought that up. I know you just mentioned some of the risks involved with medical conditions. Are there any other risks that a client would need to be aware of going into this type of therapy?
Yeah, there's sort of these different categories of risks. So, psychologically, they're going to be especially with ketamine, it's a dissociative. So you sort of have this out of body experience. And depending on the route of administration, you may feel like you cannot move your body at all. That's a really scary feeling for people if they're not prepared for it. Hallucinations, some people will value those experiences as sort of psychedelic like experiences. Other people find them to be distressing, and so again, that's part of the preparation process. Cognitively, we're looking at short-term memory problems, maybe coordination problems, increased vulnerability because they can't move or think at the same rate that they would in a normal sort of state. Like I mentioned, the heart rate, the blood pressure issues, but sometimes nausea and vomiting, dizziness can happen. And then the potential for abuse, tolerance can build if it's not being monitored appropriately. One of the other physical conditions is a very painful bladder condition, a cystitis of sorts. And so anytime we have bladder issues that come up with ketamine or people who are susceptible to bladder conditions, they're usually sort of ruled out from the screening process.
Okay. And I know there's a lot of misconceptions around what this looks like in therapy, but it is therapy at the end of the day. I wonder if you could paint a picture for us as to what a session would look like for someone that's doing ketamine assisted therapy.
Mm-hmm. There's some distinctions when we're talking about ketamine and therapy. And so, ketamine assisted psychotherapy is sort of using the ketamine while you're in the therapeutic session, whereas there's ketamine assisted therapy sort of intervention, meaning we're using ketamine, but not necessarily during the therapeutic session. And so the language is sort of used interchangeably. So I think it creates a bit of confusion sometimes. And so there are a lot of therapists in Alberta who are using The ketamine in a separate appointment, and not necessarily the therapist, maybe the person's receiving ketamine from their doctor or from their psychiatrist, and then they attend therapy afterwards. And so they're not in the same session. Then we have the ketamine assisted psychotherapy portion where they're actually under the influence of ketamine during the therapeutic session. So that's an important distinction. Our program at Psynergy Centre, we have a 3 green light process where people have to go through a medical, a psychiatric, and a psychological screen. And so that's from what I understand, that's probably more stringent than most programs, if not all the programs in Alberta. And we do that very intentionally so that we're making sure we're looking at all of the medical picture, we're looking at all the psychiatric picture, and then the psychological commitment, the psychological risk factors, and things like that. So once that occurs and someone gets 3 green lights, then they go into a preparatory phase. Sometimes that preparation might take 2 or 3 sessions. Maybe it takes 2 or 3 months. We're really trying to work diligently on addressing all the potential issues that may come up for someone, and making sure they have a true informed consent understanding of all of the risks plus the benefits. Because sometimes with these kinds of medications, we have a tendency to glorify them. And so we only consider the benefits or the stories that we've heard that sound, amazing and magical. So we have to really make sure that people understand what they're getting into. And then the actual therapy session itself is quite laid back. It's always surprising to people once they actually experience it. But essentially they show up, they have their medication. We take, vital signs, blood pressure, things like that, oxygenation, and we review their intention, which is sort of their why. Sorry, my dog is trying to get in the room. But they're reviewing their why of what they're doing and what is this all for? What am I hoping to gain from this? And then they also, in our preparatory sessions, we focus on a target. What is the thing they're wanting to resolve? And so there's the general overall why, but then there's the specific session why. And then there's the mantra, which is sort of what they're repeating to themselves to move through the medicine in a safe, calm manner. The whole time they're being monitored by regulated staff who typically have medical backgrounds of some sort, advanced care paramedic, psychiatric nurse, whatever. And the sessions last about an hour while they're under the influence of the medicine, and then they start to kind of come out of the medicine. We work primarily with sublingual, but we also do or have done intramuscular injections as well. And our hope is to eventually build on that too. So once they finish the session, or I should back up a little bit, as they're in the session, what we say when they're in, they're wearing an eye shade and they have a set of headphones on. And the music that they're listening to is sort of specifically curated for their conditions or their areas of what they're trying to work through. So it can sound a little bit different for different people. Some people really love piano music. Some people really love nature sounds. Some people love music that's more dynamic. Some people love music that's more ambient. And so we're sort of looking at the preferences of the individual, but also what we think will help move them through the process and keep them a bit more regulated. We also use essential oils to use, kind of a multi-sensory experience for them to move through the experiences. As we know, a lot of times, you smell certain smells, it reminds you of certain memories, and that can sometimes happen for individuals in the session as well. Sometimes they smell things that we haven't actually used anything, and they smell things. So it really pulls up a lot of memories for them.
That is very interesting. It's interesting to note even just the prep work that goes into something like that. I think is really important for people to understand what that process looks like. I know this is very unique to the individual, but on average, how many sessions would you say that people are typically having with this?
That's a good question. Different medicines are different. With ketamine specifically, we use a 6 treatment protocol. And so we try to do 1 dose weekly. But after their dosing session, they have an integration session. And integration is the therapeutic session that kind of pulls what are the pieces of the session that stood out for them, what are the shifts in their their perspective. That's super important. And what are the action steps that they're going to take in the next 6 days leading up to their next treatment to shift things, right?
Okay, great. You mentioned this sort of at the beginning of our conversation, but I just want to circle back to it. How do people find the approved clinics and practitioners in Alberta that work with psychedelic therapy?
Yeah, this is a tricky one right now because I suspect that as more places become more licensed, there will be sort of a directory of approved centers that will probably
Right.
be happening. I don't think that's in place just yet. Right now, only certain colleges will regulate their professionals to work in the field, such as, College of Alberta Psychologists, physicians, occupational therapists, social workers. So there's certain colleges that have already sort of said we will regulate our professionals and here's our standards of practice and things like that. But right now it's kind of more word of mouth, advertisement, Google searches. So like in Edmonton, for example, our medical director has a clinic there, Neuromed. And then I think there's another Edmonton clinic called Envision or something like that. And Calgary, there's the Newly Institute, there's at Messina, Savvy Mind, Bloom. We're the only ones in this kind of lower corner. Medicine Hat's always referred to as the forgotten corner, but it's really interesting because we have very, very highly trained staff in our clinic. So we're kind of just out here in the middle of nowhere with extensively trained people. I don't really know how that happened other than just us talking to one another and saying, hey, I have an interest in this. One of my trainings is the MAPS MDMA protocol training. And so a physician in town and I did that training together back in 2021. So it's just kind of a, hey, are you interested? Yeah, I'm interested. And then we just all committed ourselves to different kinds of trainings.
It's very cool. Yeah, I hadn't realized how much it had grown until I came across a clinic in Calgary this year, and then I started looking into it. I had no idea that they were sort of popping up. So it is interesting that it's definitely gaining some traction. Um,
Mm-hmm.
I'm curious what your favorite part is of what you do.
I would say, I tell people this a lot that I don't ever see myself going in a different direction. I'm kind of a person that I get really excited about certain types of therapy and I invest all my time and energy into getting trained in them. And then I get kind of bored a little bit. So
Yeah.
I'm really into like new and innovative things that are outside the box. And this is one area that I've committed time and energy, finances. I don't ever see myself shifting away from. It's really amazing to see people become empowered and understanding their own capacity, their own innate capacity to heal themselves. And we often use the analogy of, if someone trips and breaks their leg, they're going to be taken to the hospital and the doctor's going to set the bone and set the conditions for their body to heal. But their body knows how to heal. The doctor doesn't stand there and tell their body how to heal. And so we use that analogy a lot in this work that we all have an innate capacity to heal ourselves, that the answers don't come from me necessarily. Like I may help support guide someone through the healing process, but I sort of set the conditions and set the scene and then step out of the way. And I'm there to assure them and keep encouraging them to move forward. And that sense of accomplishment and self-empowerment that they come out of these treatments with is like just talking about it gives me chills right now. It's just
Mhm.
something else. As a trauma therapist, there's a lot of slow gains. And so when you can see people get better and you see them functioning, you see their lives turning away or turning for the better, it's just really, really cool to see. I genuinely tell them, I really want you to get well so that I don't have to see you again. So I
Yeah,
want to
no,
work myself out
absolutely.
of a job here. So, mhm.
Yeah, that's very cool. Do you have any favorite trauma resources that you like to recommend?
Yeah, of course. There's always Gabor Mate, and he's done some work too with the psychedelic realm, and addictions and things like that. And then as well, Bezel van der Kolk. He actually himself did MDMA. He sat on a clinical trial, and then also he himself experienced MDMA. And it's really interesting to hear that podcast. And then Dick Schwartz, internal family systems, that's the foundation of a lot of the work that we do in our clinic with psychedelic medicine. It aligns so nicely to help help people not pathologize themselves, identifying with I'm depressed, I'm anxious, and really refer to it more as a part of them and what is that part coming from and when did that happen and how do we heal those critical periods throughout their life so that they don't perpetuate the decision making as adults. So those are those three just right off the hop, but there's so much that the field of trauma therapy and just understanding trauma is evolving so quickly. And we have practicum students in our office who I'm often telling them, like, the stuff you guys are learning through school and right away dealing with in your practicums is way different than, I could just do my practicum when I was in grad school. I won't say how long ago that was, but like I said, 24 years almost in practice. We could have single incident kind of events, work stress, life stress. And then it was like, that was simple. But nowadays, everything feels very complex, very heavy. And so you can't, it's really hard to separate out working just with trauma versus just general life stressors, because it's kind of all blended now. So
at this point, I think if any of our listeners have not picked up something by Gabor Mate or Bessel van der Kolk, I'd be shocked, because every single podcast episode that gets brought up, they're just obviously huge experts in the field. So it constantly gets brought up.
Yeah, and I like Gabor, especially because he goes a little rogue sometimes, and I identify with that. I tend to be drawn to things that are new and different and innovative, and we didn't talk a lot about other psychedelics, but the other psychedelics, many of them are indigenous practices, ceremonial practices, so they don't really align real easily with the westernized model of therapy, evidence-based and things like that. So there's a lot of I wouldn't say controversy, but there's just a lot of confusion and just still lack of clarity about how these processes fit. And I know even with some of those things, plant medicine practices, they're wanting to protocolize them, which I'm Mexican American, and so that feels very wrong to me, to protocolize plant medicine. And so there's these things that still need to be worked through in the regulatory system as well as the practice system. And I won't get on a lot of those soapboxes. That might be a different podcast another day. But I can appreciate that there's an attempt, there's a recognition that these things do help and do matter. But I want to make sure that people understand these are not, they're not magic interventions. They're not magic pills. They still require commitment. They're used as tools. They're used to help you have perspective shifts that can get you out of those ruts and that stuckness. They're used to facilitate change, but they're not the change agents. You still have to do that work. You still have to do the therapy. And so I just want to make sure that that's, a clear message of like, yeah, these things can work really well. And sometimes they don't really work at all. And that's always a potential risk. But the main piece that we need to walk away with is these are simply tools, and they're not going to change your life. And I think that's a misconception. We have to manage our expectations around that.
I think that's a really good comment to end on, actually. So I appreciate that thought to leave us with. This has been incredibly informative. I really appreciate your perspective. Is there anything else you would like to share before we close?
Yeah, I don't think so. I any chance I get to try to help educate and destigmatize, I think that's helpful. It's the only way. Even starting here, Medicine Hat's a pretty conservative community, so having someone come in and say, "Hey, we should try these other things," and there was pushback, and sometimes still is, and that's okay, as long as we can get an opportunity to educate and try and share, and the patients speak for themselves. And so we can't necessarily say, hey, you should talk to this person, but if those people talk to their doctors, or they talk to their psychiatrists, or they talk to their friends or their family members, that really does help destigmatize the process considerably. We don't need to try to convince anybody of anything.
Yeah, absolutely. I really appreciate you coming on the podcast to explain more about this. Like I mentioned, we get a ton of questions about it, and it's certainly fascinating to learn about. So I do appreciate that. If anyone is looking for more information about Anna and her practice, you can see our show notes. Thank you so much for being here.
Thank you.
The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.